So mirror box therapy, what is it and how to perform it? And where can you get one of these for yourself? We will cover all of that today on The Upper Hand. So first off, we have included a link in the description to Amazon where you can get one of these collapsible mirrors for yourself. This makes it extremely easy to store, and it's just really nice quality. So the principle of mirror therapy is the use of a mirror to create a reflective illusion of the affected limb moving without pain. And it's used to create visual feedback in order to essentially kind of trick the brain into thinking that the hand or limb, in this case, has moved without pain. Now, mirror box therapy is actually stage 3 of graded motor imagery. I'll briefly discuss the first 2 stages later in the video, but mirror box therapy itself involves placing the affected limb behind a mirror while placing the unaffected hand outside of the mirror so that it appears to the one looking in the mirror that they are actually seeing both of their hands normally. So visualization therapy. This has been described in medical literature to be of benefit to 80% of users, although results may not be immediate. So obviously the rate of recovery is dependent on the severity of the damage done prior to use. So how does it work? So the brain consists of billions of neurons and billions of connections, and these neurons are able to kind of store a map of our body, and this is why we can still close our eyes and still touch our nose or our ear or other body parts without looking. So if you were to lose a limb, the limb may be gone, but the brain's map still has the image of the limb. So the brain continues to send those electrical signals through neurons to the limb. This mismatch between the brain's map and what actually exists is going to cause pain. So earlier I said I was going to go over the 3 stages when performing graded motor imagery. Basically, graded motor imagery is a rehabilitation program to treat many complex pain and movement problems, some of which include phantom limb pain, CRPS or complex regional pain syndrome, also known as RSD, and stroke, among other injuries or surgeries. So again, like I said earlier, there's 3 stages, each exercising your brain in different ways. Stage 1 is left-right discrimination. Stage 2 is explicit motor imagery. And stage 3 is the mirror box therapy. So let's break these 3 stages down. Stage 1, left-right discrimination. The ability to identify left and right can actually be slower and less accurate in people recovering from a stroke or suffering from pain. Clinical trials actually suggest that there's a direct link between the ability to correctly recognize left and right to the level of pain a person is experiencing. You can use cards like we have in the clinic, or you can simply download the Orientate app, and this is developed exactly for this reason. And so with this app or these cards that I mentioned, it basically shows pictures of just normal hands in different positions, and the person has to correctly identify if this is a left or a right hand. So stage 2 is explicit motor imagery, and this involves actually thinking about the movement without actually moving your affected limb. So with approximately 25% of the brain's neurons being mirror neurons that start firing when we simply see or imagine something, we call this empathy, and this is why when we see someone yawning, we have the same impulse to do the same thing. This in turn encourages the brain to find new pathways and rewire. All right, stage 3 is actually the mirror box therapy, or visualization therapy is also known as. So again, while putting the affected limb inside the mirror box and the unaffected limb in front of the mirror and looking at the image in the mirror, the brain receives visual feedback, thus kind of fooling it into thinking that the affected limb is still working. And again, this encourages the brain to adjust to its new environment. This same principle of fooling the brain also works for CRPS or RSD and for rehabilitation post-surgery or injury. Now, for stroke rehabilitation, it works differently, as it's the brain that is actually damaged and not the limb itself. So along with the neurons, we have mirror neurons, and basically mirror neurons appear to let us simulate not just other people's actions, but the intentions and the emotions behind those actions. So when you see someone smile, for example, your mirror neurons start for smiling, start kind of firing up and creating a sensation in your own mind of doing the same thing. These mirror neurons fire just by seeing someone doing something, stimulating the action in our minds. Therefore, by seeing the affected limb in the mirror essentially working, the brain is encouraged to rebuild that network within the brain and restart its communication with the limb. And the brain will actively open new pathways that have been dormant until now. So that's just a quick crash course on mirror box therapy and the 3 stages of graded motor imagery. I hope you guys learned something. If you have questions, of course, comment below and let us know. Tell us if you've been using this in your clinic. We would love to hear different strategies and different ways that have worked for you. We'll see you guys next time on The Upper Hand.